Hi everybody, this is Sam from Circle of Support. I am doing the PTSD tag. I saw it on YouTube with Destiny someone and my friend Caitlin and Jamie doing it, so I'm gonna do it. I don't know how to add it, but I'll just put PTSD tag in the tags thing and in the description. So hopefully if you search for PTSD tag, you'll find my information. I think it's really cool to do videos around a certain topics and so you can get to know everyone who's experiencing that. So I hope that more people will do this, because I know there's a lot of people on YouTube that deal with this stuff. And I'm blind and I have a screen reader, so you'll probably hear it. I wrote down the questions. Okay.
PTSD 5. Spelling error PTSD 1. What is the cause of your PTSD?
What is the cause of your PTSD? The cause of my PTSD is from emotional abuse in my family. I have an alcoholic mother and a father that's very passive, and there was a lot of domestic violence that went on when I was younger, and a lot of emotional abuse fighting, and a lot of some physical fighting, throwing things by my mom, and a lot of stuff that I witnessed. I witnessed a lot of verbal abuse from her towards my sister, my younger sister. I also dealt with, when I was younger, seeing my biological father and stepmother, and she wasn't very nice, and she was kind of against me, and she didn't like me at all, and it seemed like, I couldn't do anything right over there, and everyone over there hated me, and his kids didn't like me, and it just seemed like I remember her saying once that I was always doing things I didn't have a right to be doing, even though I was doing nothing. I think she said that in the context of I asked a neighbor for a movie or something. Anyway, so it was just, I've been in really tense environments with a lot of emotional abuse and emotional triggers of not knowing what's going to happen. And not from one day to the next, or from one, hour to the next, or minute to the next sometimes, not knowing what's going to happen verbally and emotionally around me. And I think also for someone that's blind, that is terrifying, because you can't see someone's facial expressions. The other thing I think that really caused PTSD, though, was my family's over at my biological father's and here at my, regular family, who I consider my actual family, because I was adopted at 14 by my father/stepfather, over there with my mom and everyone. Everyone saw how emotional I was, and how sensitive I was, and how much I cried, and how anxious I was, even at a young age. And I think even at a young age I had developed signs of mental illness, depression and anxiety and stuff like that I think were biological. But when they saw me so upset, instead of trying to figure it out and comfort me, they always, my mom and dad always said that I had to have a reason. You're crying for no reason, and there's no reason why you should be upset. And then if I did get teary-eyed over something, and they thought it was, it could be a little thing, but it set me off, or it hit me the wrong way, they'd be, you shouldn't be crying about that, and that's nothing to be upset about, and why are you upset? And this went on from when I was little to all the way up to now, constantly being told that I didn't have a right, basically, to feel, to be upset, to be angry. My mom would yell at us for things. She would play these games, she would clean the whole house and do all the cleaning, and then expect us to do cleaning and to know exactly what she wanted us to do. And it was, just things could turn into her yelling, so you never knew what was going to happen. And so that, I wasn't allowed to get angry. I wasn't allowed to be, anxious. I mean, the only times that I was allowed to really cry was, doctor's office, or appointments and things like that, if I got shot or whatever. But other than that, I was just always told, I couldn't be upset. Or when I did get upset, my mom would be like, well, I had to do this, I had to say this and this and that, and I had to do this, And, they said I couldn't take criticism. They said I couldn't take this, I couldn't take that. They said nobody would ever, you know, want to be my friend because they wouldn't be able to handle my emotions, and it just went on and on. And I think being blind and being in a place where you can't just go on public transportation, you can't even just go walk down the street because there's no actual street. It's there's no real sidewalk, there are no real neighbors, the houses are so far apart, and there's nothing you can really do. And you're in a town that doesn't have public transportation. The next town over has paratransit, but when I got finally signed up for it when I was 18, we didn't even know it existed until then, because my mom and my parents were so behind in, looking for different services for me. I mean, my mom fought for me fiercely in school, but in terms of of anything else for the blind, she didn't really, know. And I think if she had gotten counseling and stuff for her issues around having a blind child, that would have helped her. But anyway, I think that makes a difference too, because you're always stuck in it. And the only time I was out of it was at school. But anyway, so that's all basically what caused my PTSD, is all those emotional factors. Hold on. I had 2 cookies. I'm very thirsty. Put this cap on, it's broken. Don't break your water bottle, because other ones are really expensive. Okay, number 2.
I believe PTSD too. When were you diagnosed?
When was I diagnosed? I was diagnosed officially at 18, I think. I believe it was 18. Somewhere. Yeah, somewhere when I was 18, when I was seeing my therapist, because when I went off to college was the first time I could pick a therapist, and I went through a few different therapists, which I'll talk about in another video. But yeah, I was diagnosed, I believe, in 18. I was last officially, it officially was put on my record. Well, it is on my record now at Albany Care, that I have PTSD. And it was no surprise to me. I think I even went and told one of the therapists. I was like, yeah, I have PTSD, like, you really need to put it down. And so they did. Am I in treatment for it? Yes, absolutely. It's one of the reasons why I live at Albany Care, is that I need to be in a setting where people understand, what's going on with me emotionally, and to have staff there to talk about situations that come up. And I take medicine, and I think the medicine helps with the anxiety, which is a big part of PTSD. The medicine, being able to take 1 milligram of Ativan at night that helps me sleep, plus the Benadryl that helps me sleep and not be waking up in the middle of the night thinking about things. And yeah, so I do get the treatment. It's been hard for me to find, when I first came here, people that really understood PTSD. I think the first person that really did and really does is Jonathan. In my care plan it says that the reason why I cut and my self-injury is due to the PTSD, which it is. It's directly related to all of my life being told I had no right to feel anything except be perfect, happy, numb person, So yeah, that's when I was diagnosed, and yes, I am getting very good treatment for it. Somebody that really understands, he'll listen when things come up, and if he does something that brings it out, we talk about it. Like a couple sessions ago, and I forget how we had a good session, but I forget how this happened. Yeah, I think maybe even the loudspeaker was on, so he had to raise his voice. But he raised his voice at me, and just for him raising his voice at me just made me snap into being so afraid of him, and I was crying and stuff like that. And he gave me a hug, and he's like, "I'm sorry," because I'm like, I can't handle anyone raising their voice. And he was like, "I know," and we talked about it, and he was like, yeah, he's like, I want us to have a good relationship, and if I'm doing something that's, making your triggers, worse, we're working on all that, but why, get you so upset, And there are things that we worked out as time went on, In the very beginning, he would do things like, and he's just a very animated guy, you have to understand this. So he sits on a ball, like a round therapy ball. He doesn't sit on a chair. And that's because of his back. He sits on this round therapy ball, and you can hear it squeaking, and he's sitting there. And he plays with a pen while he's talking, and he will raise his voice. You know, when he gets really excited about something, he raises his voice. And so we were talking about being mad, and he's like, you know, what are the good things about being pissed off at people? You know, and he wasn't mad at me. He was just all wound up. You know, he was banging his pen, and he bangs on the desk. And finally, I said, I'm not gonna. I got really upset. I jumped up and tried to run out of the room, which I used to do. I was like, I'm not gonna sit and watch you like go off for no. You know, you're so mad. And he's like, no, I'm not mad. I was just throwing my pencil, and yeah. So, you know, he learned, you know, a lot about what my triggers are, and you know, that helped immensely. And we're working on it, you know, and he has no judgment about when things come up, and, you know, we're working on separating, you know, the past triggers from what's going on now. And he is extremely sensitive about it because he know, you know, he's worked in the field forever. I mean, he probably has trauma of his own. Of course, I'm not going to ask him, but, you know, he probably knows what it's like, and he's probably worked with a lot of different people. And, you know, he's just extremely, extremely sensitive. And the other therapists I've had too have been extremely sensitive, especially the ones that have tried to get me to open up more, which Deborah, the voice movement therapist, definitely did. And she definitely, you know, talked a lot about, you know, that my parents weren't being, you know, cruel. They didn't have the skills to handle, you know, their own emotional issues, never mind, you know, mine. So they just try to push everything under the rug. Anyway, so yeah, that's my treatment, is basically meds and therapy. Number 3. Who knows about it? A lot of people. Basically anyone that when I introduce myself on a forum or on YouTube or to someone on my email list, I tell them I have PTSD. You know, my roommate Jess knows about it. All the staff here know about it. You know, they need to know. The staff at New Foundation Center, you know, or they're going to know. It's in my charts, so, you know, and I emphasize to them all the things that I deal with, and, you know, PTSD is one of them, so I'm not shy about saying what's going on with me, because I feel like that's the only way you can get services and stuff. So, yeah, as many people who I feel like need to know about it, you know, I mean, it's so hard, you know, when you can disclose your mental illness to somebody and they might not get it. You know, I'm around so many like mental health focused people now because I live here that, you know, I'm not going to really run into any problems. I remember once I saw the news once and I was living at home and my grandma was watching, and it was a PTSD thing. I don't think it was about veterans. I think it was about like a girl had gotten into a car accident and had PTSD, and she's like, what is this PTSD? I'm like, no, it's PTSD, not PTSD. And she's like, well, what is it? And I'm like, well, when you have something, you know, traumatic happen, like a car accident, or, you know, growing up in a difficult family with, you know, abuse, or, you know, raped or things like that, you know, I said you develop this response, and you know, you can't sleep, and you're always anxious, and you can't, you know, things remind you of it, and you just get overwhelmed by memories. And, you know, I tried to explain it to her in the best way possible, and she's like, oh, well, that just sounds like somebody who woke up one day and decided they wanted to have post-traumatic stress disorder. I was like, excuse me, you know, but she is my dad, you know, my dad's mom, not the biological dad, but my dad. And that family, you know, he is not an emotional guy at all. You know, they are all about sweeping things under the rug too. I mean, they didn't even know about child abuse until, you know, one day they realized that they were doing it when they were hitting all these kids with the belt, you know, talking about my mom's parents and my dad's parents. And I think that's, you know, they were traumatized themselves. They were abused themselves physically. And I think any kids that were in that generation of being abused, of having the belt and whatever, is abused, because that is just not okay. But that's my opinion. So yeah, I tell whoever I think needs to know about it, and the people that don't need to know about it, they don't know about it. Let's see.
What are your symptoms?
What are my symptoms? Anxiety, especially in new situations with new people who I don't know, you know, who I'm going to have to open up to, like new staff, or, you know, a doctor, or just, you know, new people that I'm expected to open up to, like going to a program or something. and meeting new clients. Raised voices is a huge one. Certain tones of voice that are just like, well, geez, God, I was just trying, just like anyone that's fed up with me, or like, just any like passive aggressive like tone, or, loud raising their voice, or anything about like, oh, I do so much, and this is how you treat me, or, any indication, whether it's, spoken or not, of like, you're not allowed to feel this way, even if it's said like really nicely, or like a therapist is saying, well, this and that, and if you just change your thoughts, then you won't need to, be dealing with these negative thoughts, which we don't want these negative, thoughts. We don't want this and that feeling, and that, I translate that to be, you shouldn't be feeling how you're feeling, and it's any little thing on it, it just sets me off. And what used to be so bad, and it still is, but I think Jonathan has talked to everybody to help them not do this, because it's a natural thing when someone's upset to say, don't cry, and when they say that, to me, it means don't cry, because that's what they'd say. When I was upset, my parents would literally be like, don't cry, like, stop crying. And, people here would be like, stop crying. I mean, they meant it in like a nicer way, they wanted me to calm down and stuff, but they didn't realize that I had so much emotions in me, I have to express it, and then I can talk about it, hopefully, but first I have to get it out, and, unless they want me to be really destructive, like I used to be with the cutting, they're going to have to watch me cry or be angry or whatever until I'm ready to talk about it. And I've finally come to realize that just, who I am. And for so long, I just felt so sorry, not sorry for myself, but just so bad. Like, I knew that I was different. I knew I felt like, gee, everyone else can do this. Everyone else can just brush their feelings away and, put everything, block everything out. And, and I'm different and I can't, I break down so easily. And, I knew it wasn't right, because my parents kept saying it wasn't right, but I didn't know how to stop it. And that's when I one day grabbed, trigger warning, I guess. I'll just say, when I first started with self-injury, I was so happy, because it made me feel like this is the thing that I can do to go from an experience where I'm very, very, very extremely emotionally overwhelmed, I can't take it, to doing the self-injury and being a lot calmer within 10 minutes or something. It depends on what was going on, but we'd be doing all this stuff to get ready for college, and I was feeling upset all the time. And even then, I was seeing a psychiatrist, and I was on a little bit of Zoloft, but I wasn't on nearly as much meds as I should have been. And I would be upset, and I would take a break. Where in the past I wouldn't be able to. I wouldn't be able to calm down. It would take me the longest time. I wouldn't be able to calm down at all. I'd have to be alone for like an hour or whatever. And this, I could calm down in like 10 minutes or whatever. And it made me, and they would still see me upset. And even then they'd still be like, don't cry, blah, blah, blah. But they didn't see half of it, because I was doing the self-injury. And I was, being able to, stop this and, be like a normal person, I thought. So that one of the symptoms is the self-injury. Another symptoms was the triggers, raised voices, sudden changes, anyone being unpredictable. So if their mood changes suddenly, if I feel like I've done something wrong, if I feel like I need to walk on eggshells around a person, and I know it's not like rational, but I just get that feeling. If anything, it's a lot of, if an experience reminds me of what happened, then I'm just overwhelmed with all the feelings of what happened, and I can't get out of it, and it's just so difficult. What else? I don't like unpredictable, like I said, I don't like changes, I don't like unpredictability, I don't like anyone saying I shouldn't feel how I feel, I don't like raised voices, I don't like having to open up to new people. Trying to think. There has to be more. I sometimes have intrusive thoughts. I mean, yeah, for a while, every so often I'll have intrusive thoughts. But like I'll get stuck on a certain memory and be thinking about it. But I usually don't let that I'll tell Jonathan or something, or I'll write him an email or something, and yeah, so, anytime my triggers and stuff come up, I usually do talk to Jonathan right away, or a staff member, usually Jonathan, because he's the one that understands it the most, and he just listens and we just process it. Trying to think of anything else. Yeah, tones of voice, unpredictability, the emotions thing, the intrusive thoughts sometimes. Oh, sometimes I'll go through a stage. I went through a long stage. And Jonathan and I were talking about this the other day. He says, I don't think that deep down you have low self-esteem. He says, I think that you know who you are. He says, and that you know who you are. And you don't believe that you're like the lowest person ever, He said, I think you have a lack of confidence in yourself, sometimes. And he said, I think you try to talk yourself out of that you know who you are, But I did go through a long stage of feeling like I wasn't worth being a friend. And because Jess was such a good friend to me, and all my life my parents had told me, which is another trauma, they would tell me over and over again that I wasn't a good friend. And that, I wasn't like everybody else, and no one wanted to be friends with me, and what could I do? And sighted people, didn't know how to be with me, and I didn't know how to be with sighted people, and it was this whole big thing. So when I had Jess, we went through so much therapy sessions with him and I about that I just didn't feel worthy of being a friend. I felt like I was this big burden, and I felt like it was going to just end, and that I was going to hurt her. And when she would say nice things to me, it would actually physically hurt. And I would cry and cry and cry and cry because I've been never used to hearing them, especially from a friend. She'd say, I love you. She said, I'll always be there for you. And I never understood how she got into it that quickly. And I still don't. But, over time, I started to feel, more and more like I was worthy. I was helping her. And I think it was a combination of things. I mean, it was talking about it. It was also like getting my feelings out about it. It was, just different things were happening, and then slowly I felt more and more, like I was worth it. And then eventually came to a time when I was like, yeah, I am worth, being a friend. But it took a long time. And I think anything that has to do with trauma, like any reminders of it that you have to like integrate into your life, is going to take a really long time, and it could come back. Like it came back for me in March when her grandma died. And I all of a sudden felt like there's no way I can support her. How can I help her? Because I never like really helped someone whose parents died or someone close to them died. And I didn't know. I was like, how can I support her? I'm anxious. I'm anxious already. What if I have a meltdown? What's going to happen? And I can't do it. And I think I just got triggered into feeling like I wasn't worth it as a friend. Worthy. And I also got triggered into feeling like, when I was younger, I had to support my mom emotionally and my dad through really hard times, and just feeling overwhelmed on it. And that was when I did go to the crisis center, and we picked ourselves up from that, and everything else like that. But we picked ourselves up from that and kept going. And, like for some reason, when Jess gets irritated, like I said, the irritated tone of voice, or is just tired or moody, I start to feel like I just want to disappear, and like I don't, I just don't want to even be there, walking on eggshells, just like, oh my God, I don't even want to like disturb one piece of dust, because something could happen, and it's just such an anxious feeling. And, he said, we'll work on it, and I talked to him about it, and that makes all the difference, so I think those are my symptoms as far as I can think of them.
Psychiatrists, PTSD,
where's
PTSD 5. Hardest part of living with this disorder.
Hardest part of living with PTSD is that it's in layers, and that stuff comes back when you think you're done with it, Like this stuff about working so hard to be, worth for Jess and worthy as a friend, and then to have it come back again, or I worked so hard, to talk about my feelings and, to not cut, and I can list all these coping skills, but then when it came to a crisis, I couldn't do it, and I felt just devastated about myself. I was like, what the hell does it matter? But he was like, no, he's like, it's like you're running a race, and, you're upset that you can't run 10 miles, but you ran, 6, and before that you couldn't run, 2 miles, and it's just a work in progress. He says, and those moments when you make a mistake or something happens is when you learn from it, you know. But it's the most frustrating thing that it keeps coming back, and it just keeps coming back in different ways and in different situations. And you know, I don't think that you can, like, some people are like, oh, if you meet some or other diagnostic criteria, then you don't have PTSD anymore. Well, I don't think you can ever, and this maybe for like well, I'm not even gonna say, to me, in my experience in talking with my friends, and this isn't a clinical thing, but I feel like you will always have to deal with PTSD. Like, maybe not as bad as like when it first happened, and you're always going to learn skills, and obviously you want things to be easier, and you know, you want to be more okay with the memories and you know, organizing things in your mind better so that it's not always hanging over your head, and you know, everything else like that. But you know, if somebody were to say like, okay, you don't have PTSD anymore, never even think about it, you know, well, that's when I would come back, like, for me, because you know, I'm an anxious person, and I need to be prepared and to feel like, yeah, I need to look out for this, you know, that it is going to come up, and that I need to have the resources to help myself, you know, when it does come up. And I think that that's one of the hardest things for people to understand. They think PTSD is, well, at least now it's gotten more coverage from people from the war, you know, and that's great, because for the longest time no one even knew about it, like, you know. And so I'm glad that they have, you know, stuff for that. You know, they think it's for the war, you know, they'll understand like a car accident and or like rape. But then again, you know, with a one trauma event, I think what's hard for people that have had single trauma events is that people think, oh, you'll get over it, you know, and when they're not better in like a year or something and they're still dealing with it, I think they must get a lot of judgment, you know, about, you know, why aren't they over this thing? And you know, that thing is huge and could set off huge things in their brain, and you know, bring up underlying issues, or just be such a huge trauma that they need a long time to cope with it, and it might always be there, and it might not. But I'm just saying, like, you have to look at all the possibilities. You know, I'm happy for anyone that's, you know, done so much healing that they don't feel like they have any symptoms anymore, and it's, you know, for years. And that's great. But I don't want people to think that like that's going to happen for everybody. So that's the hardest thing for me, is feeling like I've you know, gotten one thing under control, and then something else comes up, or I've, you know, thought like I've gotten something under control, and then that same thing comes up. And you know, the PTSD isn't like an everyday thing, but when it does come up, it's really bad in terms of making me have an emotional meltdown or want to self-harm or something. So that's the hardest part.
6. Coping skills that help you.
Coping skills that help me. Therapy, talking with Jonathan, talking with my friend Jess, who does listen. I don't know if she has PTSD, but she does listen, and she understands. Writing on my email list, because a lot of people on the email list have PTSD. We are a huge group of people that I think almost all of us have some form of PTSD, you know, from maybe a single trauma event to a lot of people have DID and complex PTSD. So yeah, I mean, they are a great group to talk to and listen to. Listen to an audiobook, hanging out, laying down. Sometimes the best coping skill for me is just taking a nap, because it just resets me a little bit, and you know, I get to just relax. Taking Ativan, you know, when I start to get really, you know, even a little bit fired up, because things can, you know, progress, go kind of quickly, you know. It's better to be safe than sorry, and they'll just give me a PRN, and that's what it's used for, you know. And the nurses handle the meds. I'm not going to get addicted. It's, you know, once as needed every 6 hours, and then scheduled at night. So it's pretty clear with the instructions on that. Other coping skills, yeah, just writing. Writing in my journal, writing in the email list, talking to Jonathan, talking to Jess, talking to my caseworkers, napping, listening to books, reading. I think those are all the ones. And like I said, just trying to keep open about it. Jonathan and I were talking about this the other day, that he says, you know, the minute there's a problem, that you think there's a problem with something, tell someone. You know, don't let it be inside you for like longer than like a short amount of time. Because he's like, the minute you like don't tell someone, or like think it's nothing and push it away, or be like, oh well, you know, that's when it's gonna be internalized inside you, and you're going to think it's like all your fault, and it's just going to build up, and then you're going to scratch, and then you're going to want to go outside the care plan, and then you're going to want to totally have a field day, and you'll be in the hospital, and so yeah, so that's what I do. I try to tell a caseworker, as long as there's one that's here that I like, or I write Jonathan, or I can call Jonathan, leave a message on his cell phone. He usually doesn't answer it, but I can at least leave a message. And so yeah, that's how I handle it, and that's good. I mean, in the past, my coping skills was just like, oh, I'll scratch. That's it. When I feel something overwhelming, I'm just gonna scratch, and that'll calm it down for a little while. So I feel like I've really progressed.
Documents by PTSD 7. Misconceptions about PTSD 8. What would it 8? 7.
Okay, 2 more questions. I feel like we've talked forever. Sorry, guys. Misconceptions about PTSD. Well, we talked about this a little bit. That people think it's only for war victims, or for a single trauma events like rape or car accidents. I don't think they really see like child abuse as to cause PTSD. I think a lot of people don't see that link, even some professionals. I don't think they see the link of like, your childhood could be that traumatic, or even, they might even be like, well, I could see like PTSD for like sexual abuse or physical abuse, but not emotional abuse. And I think for a lot of things, emotional abuse is very misunderstood and kind of brushed to the side, and like, okay, well, that's really not, we can't do anything about that, or, that's not really as bad as some other thing. And, and sometimes, when we're with other people that are abused, recovering, and we see like other people that have had, what we feel is like worse abuse than us, then we start to be like, oh, well, I was only like emotionally abused, and maybe that's not as bad, that's not as bad as someone that was like sexually abused. And it took me a while of talking to my friends on the email list and to Jonathan to be like, like abuse is abuse, and don't compare yourself to somebody else, because what you went through was traumatic for you, and all of my history and everything else would say, why it was that way. So I just think it's misconceptions around what it is, and around that it takes a long time to help with it, and that maybe, because people are so quick fix that, oh, well, my insurance can only pay for therapy for 12 weeks, and surely like that's going to be enough to, fix this. And so I think that's a misconception. Advice I would give people, and what I want to tell people, is to be patient. And I know I'm saying that for myself. I am not the most patient person, especially when I have a setback. But be patient. Work really hard to find a good provider. If you find someone that's really, brushes aside PTSD, or doesn't believe it, or just tells you, oh, you need to do, if it doesn't, if a method of therapy doesn't work for you, find something else. Like there are people that do EMDR, and that works for them. There are people that do cognitive therapy, and that works for them. And those are like the standard treatments that the research supposedly says are most effective. But that's not everything that you can use to treat PTSD. Like there's a lot out there, and I would not want somebody to. And I would think any good therapist would be like, okay, I see that my method's not working. Like, I'll refer you to someone. So I think it's, it's trying to figure out what you want, like even looking on the internet and looking at different things to treat PTSD. And then, trying to find a therapist that, of course, accepts insurance, which is a huge issue. And, trying to be open with them. I mean, it's hard. It's hard, especially if you went through emotional abuse, to trust someone else. And I think it's just, like I said, being patient, being willing to ask for treatment, and being willing to try to open up and be vulnerable, which is so scary. That's why I think support is really important. And, having a group like the groups that I run on the email list, where people can just talk about what goes on in therapy, how they're doing, and other people can support them, because we've all been there. So I think that's, the only advice that I can give is, you've been through all this horrible stuff, and no one can ever take that away, really, the effects of it. I think, like I said, it's always going to stay with you. But, so the only thing that you can do is, try and get it to a point where you feel like you can live your life. Even if this stuff happened, that it happened and that you are able to manage it. That it's not like managing you. Like Jonathan will say that about his staff in a staff meeting. He'll be like either the situation, like with a crisis, he'll be like either you're managing the situation or the situation is managing you. So like it's true though that getting to a point where you can have some control, or at least not control, but like understanding of what's going on and understanding of like what you can do about it. That doesn't mean you're always going to do like the healthy thing, but at least and you know when to ask for help. And I think that's all we can do, and that's the best we can do. So I have talked for like a half hour. I hope you guys listen to this, but I think it is kind of educational. So yeah, see you later, guys. Bye.
My movie document site was enter PT. My movie. My help but web stop button.